Good afternoon to you all, and also welcome to you all in this pharmacy laboratory. Today's first experiment of pharmacy, that is experiment number 1, is name of the experiment prescription order writing. You must know that is today's name of the experiment is prescription order, not prescription writing. Prescription writing and prescription order writing are quite different topics. Prescription writing is a broad term which also includes prescription order writing. But prescription order writing is a limited term, and prescription writing is, that is, it includes from very beginning complaints of the patients, systemic past history, present history, occupational history, history of the present illness, family history, systemic examination, and after that provisional clinical diagnosis. And if investigations are required, so many investigations are advised to make a proper clinical diagnosis. And only then comes prescription order writing, that a clinician, after examining the patient and making a diagnosis, he has various therapeutic options such as medication or surgery or physiotherapy or even no therapy at all. For drug therapy, he has to write a prescription order. Then question arises, what is prescription order? The prescription order is a medico-legal document which is a written, handwritten or electronic, directed by a registered clinician to the pharmacist or chemist to prepare and or dispense a specific pharmaceutical agent or medicine for a particular patient for the diagnosis, prevention and treatment of a disease, or to modify certain physiological state for the benefit of the recipient. Coming to the types of prescription. Types of prescription, there are mainly two types of prescription. Before describing types of prescription, the first we must know what should be the learning objective of the student. The learning objective is, by the end of this class, MBBS semester 4 students will be able to identify the components of a prescription, appreciate the medico-legal aspect of different components of prescription, understand the common errors present in the prescription. Next, identify dangerous abbreviations that should be avoided, and to write prescription order correctly. Types of prescription, there are mainly two types of prescription. First is pre-compounded prescription. In this type of prescription, drugs are prescribed by its generic and or brand name, which direction to the pharmacist or chemist for dosage form, example tablet, capsule, syrup, suspension, injection, mixtures, ointment, cream, lotion, powder, etc. Strength of the drug, its dose interval, and dose duration. Example: ciprofloxacin 500 mg twice daily orally for 7 days. Next type of prescription is compounded or extemporaneous prescription. According to the written direction or order of the clinician, pharmacist prepares the medicine and after well labeling dispense it to the patient. Difference between pre-compounded prescription and compounded prescription. Pre-compounded prescription drugs are described by trade name or generic name prepared by the manufacturing pharmaceutical company. But in compound prescription, their drugs with its different ingredients are compounded or prepared by the pharmacist as directed by the clinician and after well labeling dispensed to the patient. Pre-compounded prescriptions are more common these days. Compounded prescriptions seen in limited scenarios, example Ayurvedic preparation. The compounded prescription comparatively safer because drug forms are not modified. But in compounded prescription, high risk. There is high risk. Examples: peppermint water case of United Kingdom, wrong strength of chloroform water leading to death of a child. Parts of prescription order writing. There are so many parts of prescription order writing. These are first prescriber's information, that is details about prescriber. It is usually printed on the top of the prescription letter pad and includes name of the clinician, his her qualification, designation, address, contact number, and especially in United States of America, DEA number, that is Drug Enforcement Agency registration number. Also, address of the clinic or hospital. There comes date of the prescription order writing, and third point, that is details about patient, where name, address, age, sex, religion, body surface area and or body weight, and height of the body should be mentioned. Fourth point is superscription, denoted by the symbol RX, meaning take out in the name of Greek gods of healing, namely Jupiter and Venus. Then comes the next point, inscription. Inscription, earlier it was known as the main body of prescription. Through this part of prescription, the clinician used to direct the pharmacist to compound the preparation. So clinician used to write the main drug responsible for the desired effect called basis part of the inscription. Next, EC used to write that drug which is to be added to promote and enhance the effect of basis called adjuvant. Then EC used to write the undesirable effects of basis and argument to correct the bad taste and other of the basis and argument to make the preparation or medicine easily and pleasantly acceptable by the patient. Finally, she writes some inert substance to be added to increase the bulk of the drug for easy intake by the patient. This is called vehicle and solvent. Solid vehicle is called excipient. You must know that vehicle is a broad term which includes all forms of drugs, whether it is solid, liquid or gaseous. While excipient is limited to the solid form of the drug. So briefly we can say that inscription gives information about the name of the drug or drugs with their generic or trade name, its formulation and unique dosage. Subscription is the next part of a prescription. It provides information to the pharmacist about the quantity and dosage form of the drug or medicine to be dispensed. However, after the advent of branded formulation, this part is rarely described in modern prescription. Next part of the prescription is signa or signatura, or also known as signature. It is clinician's direction respectively to the pharmacist, attending medical staff and to the patient to level the directions while dispensing the preparation or medicine, which includes the quantity and time and frequency of dosage to be taken by the patient. It should preferably written in local and native language for the easy understanding of the patient. Next part of the prescription or the writing is refill and other instructions. Refill, it is the clinician's direction for the pharmacist and or chemist as well as for the patient, and it includes how many times a prescription order can be dispensed to the patient. It also includes a special instruction or direction for the patient about the medicines prescribed. Maximum refill number is 6 and refill time should never exceed 6 months from the date of prescription order writing. On the other hand, narcotic drugs are never refilled. Other special instruction is substitution for the prescribed drugs allowed or not allowed should be mentioned in the prescription. Whenever any drug reactions occur, stop taking drugs and immediately consult the local doctor or me should be mentioned under a special instruction. Ready. Next and ultimate part of the prescription is signature of the clinician with registration number. Registration number. No blank space should be left between the body of the prescription and the signature of the clinician. Now coming to the both types of prescription order writing. This is the example before you which depicts the traditional or compounded prescription order writing. Here, first part of the prescription, that is details about doctor or prescriber is Dr. A. Kumar, MD, Associate Professor, Department of Medicine, SKMCH, Muzaffarpur. Then comes contact number, that is mobile numbers, address of the clinic, Kalyani Chowk, Muzaffarpur, residence, same address. DEA number, that is Drug Enforcement Agency registration number for United States of America only, not in our country. Second part of the prescription is date of the prescription order writing. Here date is 2 September 2020. Third part of the prescription is details about patient, that is Sri S. Kumar, son of Sri Naresh Kumar, address being Kanti, Muzaffarpur. Age 28 years, Hindu male, religion and sex, denoted by HM here. Weight of the patient, body weight of the patient is 68 kg. Next part of the prescription is superscription, here denoted by the sign RX, which and then comes inscription, which is the body of the prescription, and here quinine sulfate, this 0.6 gram, dilute, which is the basis, that is principal or main ingredient of the medicine, dilute lated HCl 0.6 ml, which acts as an adjuvant, syrup of lemon 4 ml, which acts as corrective, also known as purigent. Chloroform water add up to 30 ml, which acts as a vehicle. Next part of the prescription is subscription, that is direction to the pharmacist. Here mix well and make a mixture and supply such 6 doses to the patient. Next point is signature. One, that is instruction to the patient, attending staff, as well as to the pharmacist regarding dosing of the drug being taken by the patient. One dose, that is 30 ml, to be taken orally 8 hours. Then next point is refill. Once after 2 days. That is, drug should be dispensed by the pharmacist only once on the same prescription, same dated prescription, but only after 2 days. Other special instruction, that is substitution not allowed. It means that in inscriptions, different drug ingredients indicated is quinine sulfate, dilute HCl, syrup lemon, and chloroform water. These 4 ingredients should not be substituted by the pharmacist. A special instruction is whenever any drug reactions occurs, stop taking drugs and immediately consult local doctor or me. Lastly, signature and registration number of the clinician is denoted, which is the ultimate part of a prescription order writing. That is Dr. A. Kumar, registration number. Here denoted is 2263. Coming to the second type of prescription, that is pre-compounded or current model prescription order writing or modern prescription order writing. Here first part of the prescription, that is details about clinician, and details about, second part, details about patients and date of the prescription remains same. There is no change as in the compounded prescription. Then comes superscription followed by inscription. But here no inscription is, there is no indication of inscription. Here drugs are prescribed in the trade name or brand name. Here in this prescription, tablet Ciprovir 500 mg, one tablet to be taken twice daily for 7 days. Then tabbed Montimac AL, one tablet to be taken orally once daily for 7 days. Third ingredient is Calpol 500 mg, 3 tablets. One tablet to be taken whenever body temperature is 100 degree Fahrenheit or more than 100 degree Fahrenheit. Then comes Bucosul capsule, one capsule to be taken orally for 7 days. Here the fill time has been shown 0 time. That is, once prescription has been dispensed, whenever patient reaches to the chemist or pharmacist to repurchase the same drugs, he should never dispense the drugs because here the fill time is 0 time. Other special instruction is review after 1 week. Whenever any untoward reaction occurs, stop further intake of drugs advised and immediately consult local doctor or me. Lastly, signature of the doctors, that is Suman Prabhat, and their registration number. Note, in the above prescription, Ciprovir is the brand name of ciprofloxacin. Montimac AL is the brand name of Montolucast 10 mg, Levocetirizine 10 mg, and Ambroxol 60 mg, and drug is manufactured by the MacLeod Pharmaceutical Company. Calpol is the brand name of paracetamol, and Bucosul capsule is a brand name of B-complex preparation. Look at this table. Here labeling has been shown. You should know, it must be clear to you all, that labeling is not a part of the prescription order writing directly. It is to be performed by the chemist or pharmacist. But because here you all have to act as both prescription order writing as well as acting as a pharmacist to prepare this medicine in the lab. So you must know how labeling is done. In this labeling, that is name of the patient, Sri S. Kumar, with address of Sri Naresh Kumar, Kanti, Muzaffarpur, and then lab registration number is noted. This is the essential part of the labeling. Here registration number is 07 dated 3 September 2020 and also date of the dispensing and labeling is done, noted. Then comes details about the medicine dispensed to the patients. Here each ml of the medicine prepared contains quinine sulfate 0.6 gram, dilute HCl 0.4 ml, syrup lemon 4 ml and add water up to 30 ml. 30 ml of the mixture to be taken orally thrice daily by the patient. And lastly, dispensed by K. Kumar pharmacist. But here in the lab, you all have to write your own name and roll number. And note a special instruction that is shake the bottle well before use. You must also know that quinine is light sensitive. So you should also write that store the bottle away from sunlight. Okay. Now coming to the next important point, having conclusion. A safe and ideal prescription order should have following features. First, prescription order should be written clearly and easily readable and should not create any confusion. Next point, there should be a space between a number and its units to make it easier to read. There should not be any full stop and or dot after abbreviation. Shown here on left side incorrect writings and on right side correct writings. 10 mg or 10 mg with dot in the last is the incorrect and correct is 10 mg. 10 is separately written from its unit milligram mg. 10 ml or 10 ml with dot is incorrect on the left side. On right side it is shown 10 ml. It is correct method of writing. Next point, third point is trailing zeros should be avoided because if decimal point is misinterpreted or missed, a tenfold overdose can occur. On left side incorrect, see 2 decimal 0 m is the incorrect way or practice of writing. Correct should be only 2 mg. So after any full number, complete number should never be put any point or decimal. Other point, fourth point is leading zero should be preferred before decimal number. Incorrect decimal 5 mg on left side. Correct would be 0.5 milligram. On the right hand side is the correct method. Next point is for dosing instructions, abbreviation should be avoided. Once daily is preferred to OD, OD, twice and thrice daily should be preferred to BID and TID. 4 times daily or 6 hourly is preferred to QID. QD can be confused for QID. Local and native language should be preferred for easy understanding of the instruction to the patient. Next point is, units should never be abbreviated as U, because handwritten U may look like 0 and may lead to 10-fold overdose error. Seventh point, international units should never be abbreviated as IU, because handwritten IU can be misread as IV, which may create a havoc. It should be written in full like international units or INT dot units instead. Micrograms, next point, micrograms should not be abbreviated as microgram denoted by music, because microgram can be misinterpreted as MG. Instead, MCG or microgram should be used. Other next point is, one should avoid abbreviated drug names. Example, MTX for methotrexate, INH for isoniazid, because different people can interpret them differently. Next point, blank space should not be left between body of the prescription and clinician signature and station number. Whenever a space is left, it should be struck off to avoid misuse of the space for obtaining some drugs illegally. Thank you to you all.